Yeah, so inclusive healthcare to me is about equity and access and respect and being able to trust the people in the medical professions to go in, so I can go in and have the service that I think everyone is entitled to. I think it's about recognising that we're all entitled to a certain standard of service.
Inclusive healthcare basically means to treat us as just people, to treat us as a whole instead of just treating us like we have a disability.
Well, I mean, healthcare is important to everyone, sort of thing, and I think inclusive healthcare is obviously we can get the same service that any other person can have, and it's our right to do that.
Because it makes you feel just like a normal person.
So I've had a lot of good experiences with the health service. About 2 years ago I had septicemia, and that caused my sort of brain to stop functioning, for want of a better term. So I didn't really know where I was or what was going on, but I was there with my brother and he was able to work with the doctors and the nursing staff to establish that my needs were X and Y and Z and that they were addressed accordingly, and by the time I came to, so to speak, I was in a pretty good place and being well looked after.
A few months ago I went for an X-ray up at Joondalup campus, and I had to have a CT scan. There was a team of people there and they listened to my instructions on how to transfer me onto the bed, and then they transferred me back into my chair, and it was really good because they actually listened to me.
I went to like a gynecological appointment. The doctor was she was very, very rude, and she didn't actually even acknowledge me that I was in the room, and she spoke to basically my support worker the entire time, and she never looked at me once, and yeah, it was really uncomfortable, and I felt just, I don't know, it just was horrible. It was a horrible feeling.
Pre-planning better for surgery or whatever, and making sure that everyone knows what's going on, and that everyone knows to listen to people, to make sure that they understand what our needs are, and also don't assume that everyone's the same. Just because they may have the same sort of disability, but like say cerebral palsy or muscular dystrophy, it affects people differently. So it's up to they've got to listen to the individual.
If health service providers, nurses and doctors and allied health teams can just look at the person in front of them and don't go on automatic pilot, and have a bit of empathy and communicate with the person in front of them. Ask them questions of what's happening in their life and what they're here for, and involve them in the discussion about the healthcare plan. And think about what's going to happen when they go home. And it's not just that time that they're there in front of you. It's a whole holistic view of the person's life that's vital if we're going to have a good health outcome for each of us individually.
I think it will definitely help kids in the future to get the help they really benefit on, but also to be included.
She could have realised that I was actually a person and not just a wheelchair. It would have eased me a lot because I was very anxious about the whole thing as well. And yeah, if they'd organised it a lot better and if I had access to a hoist, that would have been, yeah, made life a lot easier and that appointment a lot less stressful.
I think attitude's a big part of it. I think education is a big part of it. So the more exposure anyone has to the other, the different, the new, the better it is. If you have any questions, please ask.